Let me switch to Ebola, because that's another of the issues that you've been having crisis meetings on. Where do we stand on the travel ban? I know that the president has said he's not philosophically opposed to it, but all of his advisors tell him it wouldn't work. Does it become a political imperative now that you've got Kay Hagan and others on the campaign trail in key races, switching position, if you will, and endorsing the travel ban, which has become very politically popular?
Well, Andrea, I think what the American people want is for their government to do what is going to work. There's no ideology here. The president wants solutions that will work in containing the spread of Ebola, protecting the American people, and again, also containing the spread in West Africa. And frankly, the judgment of the professionals who know how to deal with these issues is that if you have a travel ban in place, it drives people underground. Instead of traveling through existing protocols that allows us to screen for Ebola, they seek to evade detection. And the fact of the matter is, what we've been focused on, therefore, is screening. If people are trying to travel from West Africa into the United States, how can we screen them to make sure that they're not posing a risk? We believe that a travel ban could actually endanger people more by driving them underground and having people seeking to find ways into the United States that are outside the existing travel protocols.
Do you think you've turned the corner in Dallas?
Well, again, we're still very concerned about any place where we've seen cases of Ebola. And so therefore, there's still contact tracing being done with those individuals who came into any contact with the patient who was affected with Ebola, or the healthcare workers who we're very focused on right now as well. But the fact of the matter is, what we have been able to do is dedicate an extraordinary amount of resources to this to make sure that those two nurses are getting the care that they need. And thus far, we're heartened that they've shown some improvement, and to make sure that we're able to identify all of those people that we have to trace for contacts to those who are affected with Ebola. Thus far, we've had good results in hearing back that those people have not been infected with Ebola, but there's still, again, additional people that we're monitoring, and we want to make sure that if we see any case of Ebola present itself here in the United States, that we have the necessary medical protocols in place to contain that spread and protect the American people from this disease.